Hi, I'm Dr. Dendy Engelman. I'm a board-certified dermatologist practicing in Manhattan at Schaefer Clinic, 5th Avenue, and I'm here with LYMA founder Lucy. And we're going to talk all things skincare, specifically related to perimenopause and menopause.
I have to say, it was from, I guess, maybe 45 when things started to become visibly different. You know, I'd always been somebody who had amazing skin, and then to suddenly not recognize myself when I was looking in the mirror is quite a scary place to be. And I was trying out so many different treatments. I mean, like, I was the person that was walking in somewhere and you could have sold me anything. I was just doing anything to halt the aging process. And I think in the process of going into so many places and being sold so many things, I realized that so much of the industry doesn't work. And to actually only listen to a dermatologist, somebody that was a true expert and not just trying to sell me whatever they were trying to sell me, but actually was looking at my skin as an organ and how can we add longevity to this organ.
Patients really don't know who to turn to. Do they talk to their OBGYN, their GP? And the dermatologists are really the answer in this case, because there's so many not only age-related changes, but hormonally specifically to the perimenopausal and menopausal era. And cellular turnover slows down, so our skin is not releasing that top layer of keratinocytes, and so we don't reflect the light as readily, so we lose our radiance, we lose our glow. We go from a 28-day cell cycle of turnover in our 20s to in our 50s it can go up to 45 or 50 days. So there are things we need to do to recapture our youth, and we can do that in office with more aggressive ways and at home with skincare and home devices.
I think that's the thing. It's about how, it's how we kind of merge the best of the clinic with the best of what's available outside of a clinic. I always remember what you said. You said, I have never turned away anybody because they have got the best skin. If somebody comes to me with incredible skin, I'm so excited because I can do way more than if somebody came with skin that wasn't so good. And there's kind of more work to be done. So I guess it's amazing to work with a dermatologist that's not afraid of somebody going home and having the best skin that they can have in between them seeing you.
Yes, and I couldn't agree more. I mean, when they're using good skincare and good at-home devices, it kind of selfishly makes me look better because it's augmenting what we're doing in the clinic. So I never feel threatened by skincare or home devices that are properly utilized because they just enhance, we're all on the journey together. I want you to get your best outcome.
And everyone's going to age.
Yes.
Nobody's going to get to 80 and have the skin of a 20-year-old.
That's right.
It's not possible.
So I always say, we have kind of skincare recommendations and procedure recommendations by the decade. And so you don't need to be that aggressive in your 20s. But once we've hit 45, 50, we really do need to do some more aggressive treatments in order to help with fine lines, wrinkles, the appearance of pores, redness, sun damage. There's so many things that we're dealing with that we often need to do several modalities to address the issues that the patients are experiencing. But I love either fractionated CO2 or non-ablative resurfacing in order to help stimulate collagen, stimulate elastin, help with the skin texture and skin tone. And I also love radiofrequency with microneedling. I think that that's really important to tighten the skin and help with the things that we all are concerned about, the jawline, the neck, around the eyes. These are all areas that patients come in complaining about.
Yeah, the neck is huge. It's like the neck is the enemy. The neck is the enemy when you get older. It's the first thing to just divulge what age you actually are.
I agree.
What would you recommend to use as the best in-clinic treatment for anti-aging the neck?
So I change the parameters, obviously, because you have to be careful in thinner skin, but I do love Fraxel or non-ablative or ablative, fully ablative fractionated lasers for that area because it helps to tighten the skin and helps with sagging and crepiness. I do tell my patients the silver lining of the thinner skin, the area around the eye and on the neck, it is the first to show signs of aging, but it's the easiest to actually improve upon. Because if we build a little bit of collagen and elastin in thin skin, it really translates clinically into smoother skin. If we just build a little bit of collagen in the cheek, it's harder to perceive that change. So that's kind of the first to show signs of aging, but the easiest to reverse. So all hope is not lost. If these are the areas that you're experiencing signs of aging, that's where everyone does, because these two areas have the thinnest dermis on the body, and that's what gives our skin its structural support.
And I guess also, if you go home and you use the LYMA laser in between those treatments, you can actually remodel the skin at home to support the results that you're getting in a clinic.
Exactly. Not only is it helping to heal the skin from the procedure that I've done in office, but it actually is improving the skin quality in addition to that. I mean, the world of dermatology is always changing, and I love it for that. It's so exciting. Like every 6 months we get a new technology or a new discovery that really helps me do my job better. So that's so fun, and I think there will be a lot that's really personalized skincare where they're using your specific genome and saying what you need specifically to your skincare. We're seeing starts of that right now, but I think it's really going to be brought to a whole nother level. And I think that the at-home devices like LYMA that truly have science behind them are going to continue to expand their repertoire in order to help skin from head to toe. And there's nothing, it's not, I don't want to talk about aging in a bad space. Anti-aging kind of makes it seem like we're against it. We're pro-aging, and if you're not aging, then you're dead.
Yeah.
So we have to think about the fact that
the blessing of aging.
Yeah, at least we're here.
Yeah.
And we just want to support that process. Aging gracefully, aging naturally, that is fine for anybody who wants to do it. But for those who want support along that journey,
I think it's about
really
empowering women as well. It's empowering you to take control of your skin. I think that's really special.
I agree. I think that historically we always thought that your genes were your genes. You had to deal with the cards you were dealt. And now we're knowing different ways to kind of hack into the cellular mechanisms to actually accelerate a lot of repair processes and reverse signs of aging that you may think were inevitable.
I guess it's kind of epigenetics. Epigenetics is a new word for the consumer, and actually what does that mean for the skin, and what can work epigenetically, and actually what's claiming that they're epigenetic when actually they can't do much. And I think that's where the LYMA laser comes in, because it can work on an epigenetic level in the dermis. And I guess, a lot of the skincare market just targets the epidermis, which is not really the layer of skin
not where
that
the
you
magic
need to.
happens.
It's not where the magic happens. And I think that empowering people with the tool that they can actually work on the dermis in between treatments is where the magic happens.
I agree.
I love the LYMA laser for perimenopausal women and also women who are going through the menopause, because I think it's important to separate the two. It's not one. One is the peri and one is the menopause. And, the perimenopause as well can last up to 10 years. And it's like, what do you do in that time frame to help your skin? And whilst you're kind of figuring out as well, who should I go to? What treatments am I going to have? What's my perimenopausal skin journey? The reason why I love the LYMA laser is because it empowers you to take charge of your skin outside of a clinic. So I guess the way I see it in my mind, it's like the world's most supercharged cream. So, instead of just using a moisturizer or a serum, this is something that can actually genetically change the dermis of your skin to rebuild it outside of a clinic. I love it as well because it's inclusive. So traditionally, at-home lasers you shouldn't really use if you've got a darker skin tone. This is a first for inclusive beauty because there's no damage at all to any cells, so it's completely safe to use on all skin types and tones.
Perimenopausal phase can last a decade. And there's so many changes, and I feel like historically we didn't talk about it. You didn't share that news with your sister, your mom, your daughter, and women were kind of just suffering silently.
I think it was just the menopause.
Yes.
It was never differentiated between the two even.
That's true. And in the world of medicine, inflammation is kind of the root of all evil if we're talking about heart disease, joint disease, and skin is no different. We have this concept of chronic inflammaging, where we've had underlying inflammation in the skin that leads to premature wrinkling, redness, irritation. And so the LYMA laser is so good at addressing the inflammation in the skin that can occur certainly with the hormonal changes of perimenopause.
I guess we don't think of skin as an organ even. We just look at it as a canvas. But
Right.
It's actually an organ.
Yes, living, breathing organ, so important and often showing the reflection of what's going on internally with our overall health. And so I love the LYMA laser for this change of life period because it is helping to reduce inflammation, helps address redness, helps with skin texture, skin tone in a non-painful, easy to use at-home way. So that I always recommend to my patients when we're talking about all the changes that occur in the skin and the hair and the nails.
And the body.
During this time. And I think it's a great tool to have in your toolkit when we're trying to tackle all of these symptoms.
Yep.